Did you know that every 36 seconds, someone in the United States dies from cardiovascular disease? It's a staggering statistic, making heart disease the leading cause of mortality globally. Yet, what if the seeds of this widespread affliction are not sown by grand, dramatic events, but by the nearly invisible threads of our daily routines? You might attribute heart problems to an unlucky draw in the genetic lottery or the inevitable march of age. But heart surgeons, the very individuals who witness the consequences firsthand, often tell a different, more nuanced story. After countless conversations with these medical professionals, a consistent, almost whispered consensus emerges. When older patients arrive for critical heart surgery, their life stories frequently reveal a tapestry woven with the same seemingly innocuous daily habits. These are not malicious acts, but small, everyday choices. The kind of routines that become so ingrained, they feel like an unchangeable part of who we are. Over decades, however, these habits can act like the slow, persistent erosion of sandpaper on soft wood, gradually weakening the heart until it cries out for intervention. If you find yourself in your 60s, 70s, 80s, or even younger, there's a powerful message of hope here. Many of these detrimental patterns can be significantly altered, even reversed, and others can be sidestepped entirely with early awareness. This isn't about instilling fear. It's about illuminating the real-life patterns that surgeons observe daily, empowering you to recognize them and navigate away from a similar fate. Today, we will embark on an in-depth exploration of 7 daily habits that, with alarming regularity, feature in the histories of older heart surgery patients. Habits often practiced without a flicker of realization about their harmful potential. You might see reflections of your own life, or perhaps that of a cherished loved one, in these descriptions. In either case, understanding what to look for, what to question, and what to change could be the pivotal difference between facing the daunting prospect of surgery and cultivating a future of vibrant, enduring heart health. This journey is about foresight, prevention, and the profound impact of conscious living. If you're ready to uncover these critical insights and take proactive steps towards safeguarding your cardiovascular well-being, we invite you to join us. And if you believe in the power of shared knowledge to transform lives, consider supporting our channel by hitting the like button, subscribing, and activating the notification bell. This ensures you won't miss out on future content designed to inform, inspire, and empower you on your health journey. Your engagement helps us reach more people with these vital messages. 1. The treacherous terrain of the morning meal, skipping breakfast or opting for sugar-laden starts. One of the most consistently reported observations from cardiac specialists concerns the morning dietary habits of their older patients. A surprising number either forego breakfast entirely or commence their day with nutritionally bankrupt options, typically quick, convenient, and laden with refined sugars. On the surface, this might not sound like a siren call for alarm. After all, how many among us have grabbed a fleeting muffin, poured a bowl of sugary cereal, or simply relied on a cup of coffee to power through the morning? The perceived innocence of these choices, however, belies a more complex and potentially damaging physiological reality. The crux of the issue lies in the intricate dance your body performs to maintain equilibrium. Your heart's rhythm, the delicate balance of your blood pressure, and your overall energy levels are profoundly influenced by what you consume or don't consume at the start of your day. When you skip breakfast, you essentially send your body into a state of prolonged fasting after the overnight period. This can trigger a cascade of stress responses, often leading to an increase in cortisol, the body's primary stress hormone. Elevated cortisol, especially chronically, can contribute to increased blood pressure and inflammation, both significant risk factors for heart disease. Similarly, flooding your system with a high-sugar, low-fiber meal creates a dramatic spike in blood glucose, followed by an inevitable crash. This roller coaster effect throws your insulin response into disarray and places undue strain on your cardiovascular system. Imagine your arteries, normally flexible and responsive, being repeatedly jolted, tightening and relaxing erratically. Your blood consistency can also be affected, becoming slightly thicker, compelling your heart to expend more effort to pump it efficiently through your body. Over years, this daily microstress accumulates, contributing to arterial stiffness and the buildup of plaque. There's also a significant behavioral and psychological dimension to consider. Individuals who skip breakfast or opt for poor quality morning meals often find themselves battling intense cravings later in the day. This frequently leads to overcompensation, often with foods high in unhealthy fats, salt, or more sugar, to quickly satisfy an increasingly ravenous appetite. A vicious cycle ensues. Poor morning choices fuel poor afternoon and evening decisions. And the heart is caught in the crossfire, squeezed by fluctuating blood sugar, inconsistent nutrient supply, and increased overall caloric intake of less than ideal foods. You might not perceive these effects in your youth or middle age, but by the time you reach your later years, these seemingly minor daily decisions can manifest as the very arterial plaque and functional stiffness that necessitate surgical intervention. Consider the story of Harold, a 76-year-old retiree. He often quipped, "I've never been a breakfast guy." His mornings typically consisted of black coffee, sometimes accompanied by a single slice of plain toast. For decades, he felt fine. However, beneath the surface, changes were occurring. His blood pressure gradually crept upwards, his cholesterol levels worsened, and eventually he began experiencing exertional chest pain. By the time he was wheeled into the operating room, his surgeon gently explained that his condition hadn't materialized overnight. It was the cumulative effect of countless mornings, stretching back for decades. To safeguard your heart, the day must begin with real, wholesome food. This doesn't necessitate elaborate culinary productions. Something as simple as oatmeal generously topped with nuts and berries, eggs paired with whole grain toast and a side of spinach, or even a smoothie blended with fruit, yogurt, and a protein source can provide the fiber, protein, and healthy fats needed to stabilize your system. It's not about achieving an unattainable standard of perfection, but about constructing a consistent, reliable foundation upon which your heart can depend. Breakfast, it turns out, is not merely the commencement of your day. It's the crucial first step in determining how your body, and particularly your heart, will navigate the demands of the next 24 hours. That was the first habit, a crucial foundation for daily well-being. If you find this information about the importance of a balanced breakfast useful and are considering how to apply it to your own life, please comment with the number 1 below to let us know. We value your feedback and engagement. 2. The weight of unspoken words. Holding in emotions and evading meaningful conversations. This next habit may come as a surprise, yet it is a theme that heart surgeons raise with striking frequency. A significant number of older patients who ultimately require cardiac surgery share a common, non-dietary, non-exercise-related trait. They are emotional containers. They have, often for prolonged periods, years, even decades, bottled up an array of challenging emotions. Pain, persistent stress, deep-seated regret, simmering anger, or profound, unexpressed grief. The prevailing societal misconception is that emotional states are somehow separate from physical health, but the heart, in its profound wisdom, knows no such distinction. It responds not only to physical inputs like diet and activity levels, but also acutely to emotional ones. When you consistently feel emotionally neglected, unheard, misunderstood, or unsupported, your body doesn't simply dismiss these feelings. It carries them, internalizes them. Your sympathetic nervous system, responsible for the fight or flight response, can become chronically activated. This isn't a benign state. It translates into tangible physiological changes. Your resting heart rate may elevate. Your blood pressure might remain subtly higher than it should. Your sleep architecture can become fragmented and less restorative, and levels of inflammatory markers in your bloodstream can rise. Over time, this persistent, low-grade internal tension builds, imposing a significant load on your heart, a burden that no amount of treadmill time can fully counteract. Indeed, a growing body of scientific research substantiates a strong, direct link between emotional suppression, chronic psychological distress, and adverse cardiovascular outcomes. Studies have indicated that individuals who habitually avoid expressing their feelings, or who lack adequate social support and outlets for emotional release, are at a higher risk for developing irregular heart rhythms, arrhythmias, experiencing elevated systemic inflammation, a key driver of atherosclerosis, and are more vulnerable to sudden cardiac events. It is not a sign of weakness to articulate your feelings or seek support. It is, in fact, a fundamental act of survival. When you metaphorically hold your breath through every difficult emotion, you are, in essence, asking your heart to bear the burden of that unreleased pressure, that emotional oxygen debt. Eventually, the strain can become too much and the system can begin to break down. Consider Elaine, an 80-year-old woman who had always been the stoic pillar of her family. She rarely complained, always presented a brave face, and shouldered burdens silently. When her beloved husband passed away after a long illness, she didn't shed a tear in front of anyone. Her constant refrain was, "I'm fine, I'm strong." A year later, while tending her garden, she collapsed. The diagnosis was acute heart failure. Her doctors pointed to significantly blocked arteries. But as she slowly began to open up during her hospital recovery, her daughter confided, "It's like her heart had been slowly breaking for years under all that unexpressed grief, and none of us truly saw the depth of her pain." You don't need to broadcast your every emotion to the world, but finding a trusted confidant, a friend, a family member, a therapist, a support group, is vital. Allowing your emotions to move through you, rather than allowing them to become stagnant and fester inside you, is crucial. The heart, at its core, is a pump. It thrives on healthy flow, not on relentless, unyielding pressure, be it physical or emotional. If these insights into the connection between emotional well-being and heart health resonate with you, or if you've experienced the impact of emotional stress on your physical health, please comment with the number 2 below. Sharing your thoughts helps us understand what content is most valuable to you. And if you haven't already, we warmly invite you to subscribe to our channel and turn on notifications. Your support is invaluable and enables us to continue creating content that informs and inspires a healthier, more conscious life. Let's continue our exploration. 3. The deceptive crutch, overusing pain relievers instead of addressing root causes. Herein lies a particularly insidious pattern that heart surgeons frequently observe. Older adults who become increasingly reliant on over-the-counter OTC pain relievers merely to navigate the discomforts of daily life. The persistent ache in the knees after a short walk, the morning stiffness in the back that makes getting out of bed a chore, the recurrent headaches following a night of restless sleep. For many, the reflexive response is to reach for a pill, swallow it, and attempt to carry on as if the problem is solved. What often begins as an occasional, seemingly harmless remedy for acute pain can subtly, almost imperceptibly, morph into a quiet daily habit. And this quiet habit, unfortunately, can become a very loud problem for your heart. Nonsteroidal anti-inflammatory drugs, NSAIDs, such as ibuprofen and naproxen, are ubiquitous on pharmacy shelves and in home medicine cabinets, often perceived as entirely benign. However, when taken regularly, especially at higher doses, for prolonged periods, or without appropriate medical guidance, such as taking them on an empty stomach, which can irritate the gastric lining, these medications can exert significant, often underappreciated adverse effects. They are known to increase blood pressure, sometimes substantially. They can impair kidney function, as the kidneys play a crucial role in processing these drugs and their byproducts. Compromised kidney function, in turn, places additional stress on the cardiovascular system. Over time, this added physiological burden can be the proverbial straw that breaks the camel's back, particularly for individuals already contending with underlying conditions like high cholesterol, pre-existing arterial plaque, or borderline hypertension. Let's reflect on the case of Carl, a 76-year-old gentleman who, on the surface, appeared to be the picture of health. He was an avid golfer, playing 2 rounds a week, and maintained an active social life. However, he suffered from chronic knee pain, a consequence of old sports injuries, which he managed with daily doses of ibuprofen. He believed this was enabling him to stay active. When he was eventually admitted for surgery following a minor heart attack, the angiogram revealed significant, silently accumulated damage in his coronary arteries. His surgeon remarked, "This degree of atherosclerosis didn't develop overnight. His heart has been laboring under the unacknowledged weight of those daily pills and the inflammation they were masking for many years." You see, the habit itself is not merely the act of taking the medication. It's what that act often replaces or obscures. Each pill swallowed without further investigation can represent a missed opportunity, an opportunity to engage in gentle stretching or targeted physical therapy, to allow the body adequate rest and recovery, to explore alternative pain management strategies like acupuncture or mindfulness to modify routines that may be exacerbating the pain, or, most critically, to ask the fundamental question, what is this persistent pain truly trying to tell me? Your body doesn't ache simply as an inevitable consequence of aging. Often, pain is a sophisticated signaling system, a red flag indicating an underlying imbalance or issue. Numbing that signal with a pill, without investigating the source is akin to disabling a smoke alarm while the fire continues to smolder. Many older patients fall into this trap, not from a place of laziness or neglect, but often from a commendable desire to remain active, independent, helpful to others, or simply to avoid being perceived as a burden. But your heart, that tireless organ, doesn't operate on politeness or social niceties. It operates on principles of pressure, circulation, and inflammation. So, if your joints are persistently painful, it warrants investigation. If headaches become a frequent unwelcome guest, ask why. Don't allow the allure of temporary relief to morph into a prescription for long-term cardiovascular harm. This isn't a diatribe against the appropriate, judicious use of pain medication under medical supervision. It's a caution against allowing it to become your unthinking, default response to every ache and pain. Address the root, not just the symptom. Your heart, with every beat, will thank you for this deeper level of care. The issue of pain management and its potential cardiac implications is a complex one. If you found this discussion on the overuse of pain relievers enlightening, or if it's prompted you to reconsider your own approach to pain, please share your thoughts by commenting with the number 3 below. Your experiences and insights are valuable to our community. Number 4, the rhythm of ruin, erratic meal timing, and the pitfalls of late-night eating. While our first point highlighted the perils of skipping breakfast or starting the day with sugary, processed foods, a related and equally detrimental habit observed by cardiac specialists pertains to broader patterns of irregular meal timing, particularly the habit of eating main meals very late in the evening or adopting a generally chaotic eating schedule. You might believe that what you eat is the only factor that matters, but when you eat can also significantly influence your metabolic health and, consequently, your cardiovascular risk. The human body thrives on rhythm and predictability, and our digestive and metabolic systems are intricately linked to our internal circadian clocks. Skipping meals earlier in the day, as discussed with breakfast, often sets the stage for overeating later. When individuals finally do eat after a prolonged period of fasting, especially if that meal is large and consumed late at night, several physiological processes can be adversely affected. Firstly, insulin sensitivity tends to be lower in the evening. This means your body is less efficient at processing glucose, potentially leading to higher and more prolonged spikes in blood sugar and insulin levels after a late meal. Over time, this can contribute to insulin resistance, a cornerstone of metabolic syndrome, which itself is a major risk factor for heart disease. Secondly, consuming a heavy meal close to bedtime can interfere with digestive processes, potentially leading to issues like acid reflux or indigestion, which can disrupt sleep. And as we're increasingly learning, poor quality or insufficient sleep is independently linked to increased risks of hypertension, obesity, and cardiovascular events. Consider Elena, a 68-year-old woman who, in an attempt to manage her weight, would often skip breakfast, have a very light lunch, and then consume her largest meal of the day late in the evening, sometimes just an hour or two before bed. She'd often feel uncomfortably full going to sleep, and would wake up feeling sluggish rather than refreshed. While she thought her total daily caloric intake was reasonable, her body was experiencing a daily cycle of deprivation, followed by a late evening metabolic overload. Her blood sugar levels became erratic. She often felt dizzy during the day, and her snacking habits tended towards processed, salty foods due to fluctuating energy and intense cravings. After requiring her second coronary stent, a consultation with a nutritionist finally illuminated how her erratic meal timing was creating a state of chronic metabolic stress, directly impacting her heart health. Her body wasn't thriving. It was constantly trying to adapt to unpredictable fuel supplies, triggering hormonal shifts that negatively affected her appetite regulation, cholesterol levels, and triglyceride levels, all critical factors in heart disease development. For older adults whose metabolic flexibility may already be somewhat reduced, the consequences of such eating patterns can manifest more rapidly and with greater severity. The key takeaway here is not just about avoiding skipping breakfast, but about cultivating a degree of consistency in your overall meal pattern, aiming for regular meal times, and endeavoring to consume the majority of your daily calories earlier in the day. Allowing several hours between your last meal and bedtime can significantly support your body's natural rhythms. This allows your digestive system to complete its main work before you sleep, enabling your body to focus on restorative processes overnight, rather than still grappling with digestion. This doesn't mean you can never enjoy a late dinner on a special occasion, but making it a regular habit can chip away at your metabolic and cardiovascular resilience. Think of it as tuning your body's internal orchestra. Consistent meal timing helps all the hormonal and metabolic instruments play in harmony, supporting rather than stressing your heart. This discussion on meal timing adds another layer to understanding how daily habits influence heart health. If you've recognized patterns of irregular eating or late-night meals in your own life, or if this information has provided a new perspective, please let us know by commenting with the number 4 below. And if you're finding value in this detailed exploration, a simple like, subscribe, and enabling notifications would mean the world to us, helping us to continue producing content that matters. Number 5, the stillness that stifles. The dangers of prolonged sedentary behavior. It's a common misconception that as we age, significantly increasing our rest and reducing physical activity is not only harmless but perhaps even beneficial. While adequate rest is undoubtedly crucial, what heart surgeons have repeatedly noted is a pervasive pattern among older patients who end up requiring cardiovascular interventions. They often spend excessively long hours sitting with insufficient movement breaks. We're not necessarily talking about skipping intense gym workouts here. The concern is more fundamental. It's about the detrimental impact of simply not getting up, stretching, or walking around at regular intervals, even for a few minutes every hour or two. When your body remains stationary for extended periods, a cascade of physiological changes begins to occur, many of which are detrimental to cardiovascular health. Firstly, your circulation naturally slows down. Blood can begin to pool in the lower extremities, making it more challenging for the heart to efficiently pump deoxygenated blood back up from the legs and circulate freshly oxygenated blood throughout the entire body. This isn't just a temporary inconvenience. Over time, chronic inactivity contributes to a reduction in vascular flexibility. Think of your arteries as elastic pipes. Prolonged stillness can make them more rigid and less responsive to changes in blood flow and pressure. Furthermore, sedentary behavior is increasingly linked to the processes that encourage plaque buildup within the arteries, atherosclerosis. It's like a quiet, invisible storm brewing within your veins, all while, on the surface, everything appears calm and restful. Consider the story of Frank, a 75-year-old retired accountant. After a long career spent largely at a desk, his retirement years settled into a pattern of extended inactivity. He would watch television for hours on end, engage in crossword puzzles seated at the kitchen table for long stretches, and his primary movements were often limited to necessities like using the restroom or answering the door. He wasn't overweight, nor was he a smoker. Yet, when he began experiencing an unsettling tightness in his chest and noticeable shortness of breath during minimal exertion, his cardiologist uncovered early signs of congestive heart failure. The underlying cause, in his case, wasn't dramatic lifestyle vices, but the slow, insidious weakening of his heart muscle and vascular system due to years of profound inactivity. The antidote to this isn't necessarily training for a marathon. It's about consciously and consistently integrating more movement into your day. The concept of NEAT, non-exercise activity thermogenesis, the energy expended for everything we do that is not sleeping, eating, or sports-like exercise, is incredibly important here. This includes simple actions like standing up from your chair every 30 to 60 minutes, stretching your arms and legs, taking short walks around your home or office, opting for stairs instead of the elevator when possible, or engaging in light housework or gardening. These small, frequent movements keep your blood flowing more vigorously, help maintain muscle tone, which supports metabolic health, and encourage your heart to pump in a steady, healthy rhythm. Think of it as regularly oiling a sophisticated engine. You don't need to redline it constantly, but you absolutely need to keep it running smoothly to prevent seizure. The truth is, the negative impacts of sedentary behavior extend beyond just your heart. They affect your blood sugar regulation, mood, cognitive function, and even your sleep quality. But often, the first major organ to suffer the consequences in silence is the heart, because it can't verbally communicate its distress. It just keeps working under increasing strain until it can no longer cope. Surgeons can perform incredible feats, opening blocked arteries, installing stents, bypassing damaged vessels, but they cannot retrospectively undo the cumulative weakening effects of years of inactivity. That power lies with us, and it begins with the simple, conscious decision to incorporate small, regular movements into our daily lives, signaling to our bodies that we are still very much in the game. Recognizing the dangers of a sedentary lifestyle is the first step towards change. If this discussion on the importance of regular, light activity throughout the day has resonated with you, or if you have tips on how you incorporate movement into your routine, please share your thoughts by commenting with the number 5 below. We learn so much from our community's experiences. Number 6, the unseen saboteur, ignoring chronic stress and sustained emotional pressure. We often compartmentalize health, thinking of heart trouble as stemming primarily from tangible, physical factors: the food we eat, the exercise we do or don't do, perhaps our genetic predispositions. However, a profound insight consistently shared by heart surgeons is the significant role of the intangible, the immense weight of chronic, unmanaged stress and buried emotional pressure that many of their patients carry, often for years, unknowingly chipping away at their cardiovascular health. Your heart, that remarkably resilient yet exquisitely sensitive organ, doesn't just respond to physical exertion or dietary choices. It responds acutely and measurably to your emotional state. These aren't just fleeting feelings. They trigger real, quantifiable physiological changes in your body: alterations in blood pressure, heart rate variability, and the release of a cascade of hormones. When these stress-induced changes become a frequent, almost constant state of being, they inexorably wear down the cardiovascular system, much like relentless waves eroding a cliff face. Consider the experience of Joanne, aged 68. She had been widowed 6 years prior and lived alone, fiercely independent, and always insisting to friends and family that she was fine and coping wonderfully. Her friends described her as admirably strong and self-reliant. Beneath this stoic exterior, however, Joanne often experienced profound trouble sleeping, a persistent sense of anxiety she couldn't quite name, and would frequently feel a disconcerting tightness in her chest whenever any new or unexpected stressful situation arose, be it a minor household repair or a challenging social engagement. When she finally, at the urging of her concerned daughter, went for a comprehensive checkup, her doctor discovered persistently elevated blood pressure, subtle irregularities in her heart rhythm, and early but definite signs of atherosclerosis. Her diet was reasonably healthy, and she engaged in regular walks. As the medical team delved deeper into her lifestyle and history, it became increasingly clear that her chronic, unacknowledged stress and underlying grief were significant driving factors behind the deterioration of her cardiac health. The human heart is designed for resilience, capable of handling acute, short-term stressors. However, it is far less equipped to handle the unrelenting barrage of chronic stress. Long-term stress keeps your body perpetually stuck in a fight-or-flight mode, a state mediated by the sympathetic nervous system and characterized by the continuous pumping out of stress hormones like cortisol and adrenaline. While essential for acute survival situations, chronically elevated levels of these hormones raise your heart rate, constrict your blood vessels, leading to higher blood pressure, increase inflammation, and can even alter how your blood clots. Over extended periods, this physiological environment significantly elevates the risk of hypertension, stroke, arrhythmias, and even sudden cardiac arrest. The problem is compounded by the fact that many older adults were raised in an era where stoicism was highly valued, an ethos of toughing it out, don't complain, don't cry, just keep going. While resilience is indeed an admirable quality, the suppression of genuine emotional pain doesn't make it magically disappear. It often merely forces the body to carry the unexpressed burden, and the heart frequently bears the brunt of this internal load. The encouraging news is that emotional release and stress management are profoundly healing. Engaging in practices such as talking openly with a trusted friend, family member, or therapist, journaling to process thoughts and feelings, practicing mindfulness meditation or deep breathing exercises, engaging in prayer or spiritual practices that provide comfort and perspective. These are not soft or indulgent habits. They are potent, evidence-supported tools for genuine cardiovascular protection. Just as you wouldn't ignore a persistently leaking pipe in your home, allowing it to cause progressive water damage, you shouldn't leave a chronically stressed heart unattended, vulnerable to the cumulative damage of unrelieved emotional pressure. You are not only allowed, but encouraged to feel your emotions, to seek rest when needed, and to actively protect your heart, not just through physical means, but by nurturing your emotional and psychological well-being too. The connection between our minds, emotions, and heart health is undeniable. If you found this segment on managing chronic stress particularly relevant, or if you have effective stress management techniques that have helped you, please comment with the number 6 below. Your insights could be incredibly helpful to others in our community. And as always, if this content is providing you with value, please consider liking this video, subscribing to the channel, and hitting the notification bell. Your support fuels our mission to share health-enhancing knowledge. 7. The peril of postponement, going years without essential heart health checkups. Of all the habits that heart surgeons highlight as contributors to late-stage cardiac problems, this final one is perhaps the most frustrating for them, precisely because it is so eminently avoidable. An alarming number of older patients only discover the true state of their heart health after a serious cardiovascular event has already occurred, or when symptoms have become so debilitating that they can no longer be ignored. The primary reason they didn't seek or receive appropriate screening until it was, in some cases, dangerously late? A complex mix of factors, including a false sense of security, I feel fine, fear of receiving bad news, a lack of awareness about what constitutes essential cardiac screening, or sometimes a simple, gradual drift away from proactive healthcare engagement, especially after retirement when routine workplace health checks may cease. Consider the analogies we readily accept in other areas of our lives. We diligently take our cars for regular oil changes and servicing, recognizing that preventive maintenance is key to longevity and reliability. We wouldn't typically wait until the roof of our house caves in before considering an inspection, especially if we knew it was aging. Yet, perplexingly, many individuals adopt a far more passive, even neglectful approach to the health of their own hearts, the very engine of their existence. The critical truth that is often overlooked is that the heart can be laboring under significant strain, developing serious underlying pathology long before it manifests overt, unignorable symptoms. Silent conditions like asymptomatic high blood pressure, hypertension, elevated levels of LDL, bad cholesterol, accumulating calcium deposits in the coronary arteries, a marker of plaque burden measurable by a coronary calcium score, or subtle abnormalities on an electrocardiogram, EKG, can provide crucial early warnings, often years before a heart attack or stroke ever happens. A straightforward annual checkup with a primary care physician, which should ideally include a blood pressure measurement, a comprehensive lipid panel, cholesterol and triglycerides, a blood glucose test, and perhaps HbA1c for diabetes risk, and a thorough discussion of symptoms, lifestyle, and family history can be incredibly revealing. Based on these findings and individual risk factors, further investigations like an EKG, an echocardiogram, an ultrasound of the heart, or a stress test might be recommended. If caught in their early stages, many of these conditions can be effectively managed, often through lifestyle modifications, dietary changes, and, if necessary, medication, thereby significantly reducing the risk of progression to more severe disease. Take the case of George, aged 76. He reported feeling just a little slower these days, attributing it vaguely to getting older, but had no alarming or specific complaints. It was his daughter, armed with a growing awareness of preventive health, who gently but persistently pushed him to schedule a full physical workup, including specific cardiac screening. The results were a shock to George. One of his major coronary arteries was over 80% blocked. He had been, unknowingly, on the precipice of a major cardiac event. Fortunately, he was able to undergo a timely stenting procedure, coupled with significant adjustments to his diet and the initiation of appropriate medication. He is now doing remarkably well. His prognosis significantly improved. But his story could have had a drastically different, tragic outcome had he not undergone that precautionary checkup. Not knowing your numbers, not understanding your underlying risk, isn't a state of blissful ignorance. It's a gamble with potentially devastating stakes. Unlike some health conditions that announce their presence with dramatic early symptoms, heart problems often don't wave obvious red flags until they have reached a dangerous, even life-threatening stage. Sometimes, tragically, the very first discernible sign is a silent heart attack, or worse, a fatal one. Heart surgeons frequently express a poignant wish. If only their patients had come in for assessment 2 years earlier, 5 years earlier, sometimes even just 6 months sooner, the trajectory of their illness could often have been profoundly altered, interventions less invasive, and outcomes far more favorable. Preventive care isn't merely about avoiding pain or surgery. It's about preserving quality of life, granting you more active years, more energy, more freedom, and more time to spend with loved ones. Your heart has faithfully carried you through a lifetime of experiences. It unquestionably deserves a thorough, regular checkup to ensure it can continue its vital work for many more years to come. This seventh habit underscores the critical importance of proactive health management. If this discussion has prompted you to think about your own heart health screening, or if you have an experience to share about the value of regular checkups, please let us know by commenting with the number 7 below. Your story could inspire someone else to take that crucial step. We often relegate bad habits to the realm of minor personal quirks, biting one's nails perhaps, or occasionally skipping a walk. Yet, the sobering truth, as illuminated by the collective wisdom of those on the front lines of cardiac care, is that some of the smallest, most consistently overlooked daily choices can cast the longest, most consequential shadows over the health of your heart. This is the crucial message heart surgeons are implicitly trying to convey. The patients they most frequently see in the operating theater often haven't made one single catastrophic mistake. Instead, their conditions are typically the culmination of years, even decades, of subtle, interlocking patterns of behavior that piece by piece eroded their cardiovascular resilience. But within this stark reality lies a profoundly empowering message of hope. It is rarely, if ever, too late to make a positive difference. Regardless of your current age or past habits, your heart possesses an extraordinary capacity for healing and adaptation. It responds, often quite remarkably, to better choices. The journey to a healthier heart doesn't demand an overnight, radical reinvention of your entire life, nor does it require an unattainable standard of perfection. It simply asks that you begin. Start by identifying one habit, one small area where you can introduce a positive change. Give your heart a little more wholesome fuel, a little more genuine emotional release, a little more consistent movement, a little less unmanaged stress, a little more proactive attention through regular checkups. Each small conscious adjustment is an investment in your future well-being, and your heart will thank you for it in ways both measurable and deeply felt. Think back through the 7 habits we've explored in depth today. Did one, or perhaps several, resonate more acutely with you? Maybe it's a pattern you've been vaguely aware of, something you've been meaning to address but haven't quite prioritized. Or perhaps it's an insight that casts a completely new light on a behavior you never previously connected to heart health. Whatever your reflection, the very act of noticing, of acknowledging, is a powerful first step in the right direction. Let us not wait for the jarring wake-up call that arrives in the back of an ambulance, under duress and uncertainty. Let us, instead, choose to take informed, proactive action while the power of choice still rests firmly in our hands. You are not alone in this journey of self-care and health optimization. We are all, in our own ways, continually learning, growing, and striving to do a little better for ourselves than we did yesterday. Thank you for investing your time with us today, exploring these vital insights. We genuinely believe in the power of community and shared learning. We would love to hear from you. Please leave a comment below and share one key takeaway you gleaned from this discussion, or one specific way you plan to apply this knowledge in your own life. Your thoughts, experiences, and reflections are incredibly important to us. They not only provide encouragement, but also help shape our future content. Reading your comments truly gives us great motivation. If you found this article insightful and helpful, please demonstrate your support by giving it a like, subscribing to our channel, and very importantly, sharing it with friends, family, or anyone you believe might benefit from this information. Your support is the bedrock that allows us to continue creating and disseminating valuable content designed to inform, inspire, and empower. Thank you for watching, and we eagerly look forward to welcoming you back in our next video. Remember, the journey to a healthier heart begins with a single conscious step. Take that step today.